Most people think of blood sugar as a number, something a machine reads, something a doctor circles on a chart. But here is what I want you to understand. Blood sugar is not just a number. It is a dynamic process happening inside your body every single moment of every single day. And if you understand how that process actually works, you can influence it. Quickly, often within minutes. My name is Dr. Wilson. I have been practicing medicine for over 30 years, and I want to be straightforward with you from the beginning. There is no magic pill in this video. There is no secret supplement. What I'm going to share with you today is something grounded in how the human body actually functions. And once you understand it, you are going to have real tools you can use immediately. Now, if you are over 50 and you are managing blood sugar, whether you have been diagnosed with type 2 diabetes, prediabetes, or you have just been noticing your numbers creeping up on your labs, this video is specifically for you. Because the way blood sugar behaves after 50 is different from how it behaves at 30. And most of the general advice out there does not account for that difference. So let me start with something fundamental, something that changes how you think about this entire topic. Blood sugar is not fixed. It is being created, used, and regulated continuously. Every time you eat, your digestive system breaks down carbohydrates into glucose. That glucose enters your bloodstream. And your body has one primary tool for managing that glucose, which is a hormone called insulin. Insulin is produced by the pancreas, and its job is to act like a key that unlocks the doors of your cells so that glucose can enter and be used as energy. When that system is working well, your blood sugar rises modestly after a meal, insulin responds appropriately. The cells absorb what they need, and blood sugar returns to a healthy range within a couple of hours. That is the system working as designed. But here is where things begin to go wrong for millions of Americans after 50. Over time, especially with certain lifestyle patterns we will talk about, the cells start to become less responsive to insulin. They stop opening the door as easily. So the pancreas has to produce more and more insulin just to get the same result. Doctors call this insulin resistance, and it is one of the most common and least talked about health problems in adults over 50. What happens when insulin resistance sets in? Glucose stays in the bloodstream longer than it should. Blood sugar stays elevated, and over time, chronically elevated blood sugar causes real damage to the blood vessels, to the nerves, to the kidneys, to the eyes, to the heart. But here is the part that most people do not realize. Insulin resistance is not a fixed state. It is not something you are simply stuck with. The body can become more insulin sensitive again. The cells can become more receptive. And when that happens, blood sugar comes down. Without medication in many cases. Certainly as a complement to medication in others. The question is, how? And more specifically, how do you do that after 50? When the body changes? When metabolism slows? When muscle mass decreases? And when the responses that worked at a younger age are not as reliable? That is exactly what we are going to go through. And the first thing I want you to understand is that the most powerful lever you have for lowering blood sugar quickly is not a food, and it is not a supplement. It is something most people have been told about their whole lives, but have never been given a real explanation for why it works so profoundly. Stay with me, because the next part is the foundation for everything else. The most immediate and effective way to lower blood sugar after 50 is movement. But I do not mean the generic advice of exercise more. I mean something much more specific than that. And once you understand the biology behind it, you will never think about movement the same way again. Here is what is happening inside your muscles when you move. Your skeletal muscle tissue is the largest consumer of glucose in the body. When your muscles contract, they create an immediate demand for fuel. And here is the part that changes everything for people managing blood sugar. When muscles are actively working, they can absorb glucose directly from the bloodstream without needing insulin to do it. Read that again slowly. Your muscles can take glucose out of your blood without requiring insulin. There is a separate pathway, a backup system, that gets activated by muscle contraction. Scientists call it the GLUT4 pathway, but all you need to know is what it means practically. When your muscles are moving, they act like a sponge for blood sugar, independent of how insulin-resistant you are. This is not a small effect. Studies have shown that a single bout of moderate physical activity can lower blood sugar in people with type 2 diabetes comparably to a dose of blood sugar medication. That is how powerful this pathway is. Now, what many people do not realize is this: the timing of movement matters enormously. Most adults, when they decide to exercise, go out for a morning walk or hit the gym before breakfast. And that is certainly better than nothing. But if your goal is to control blood sugar spikes specifically, the most strategically valuable time to move is after a meal, particularly after your largest meal of the day. Here is why. After you eat, blood sugar begins to rise within about 30 to 45 minutes. It typically peaks somewhere between 1 and 2 hours after eating. That is the window. If you can get your muscles moving during that window, even modestly, you intercept the glucose before it fully accumulates in the blood. Your muscles absorb it, the spike is reduced, the recovery is faster, and the amount of movement required to produce a meaningful effect is much smaller than most people expect. Research has consistently shown that a 10 to 15-minute walk after a meal produces a significantly greater reduction in post-meal blood sugar than a 45-minute walk at some other point in the day. Not slightly better, significantly better, because the timing directly intercepts the glucose wave. For adults over 50, this is particularly important, because after 50, that post-meal blood sugar spike tends to be higher and longer lasting than it is in younger people. The pancreas does not respond as quickly. Insulin secretion is slower. The glucose sits in the blood longer. So the window where movement can make a dramatic difference is both wider and more consequential. Now, some people hear this and immediately think they need to go for a brisk jog after dinner. You do not. A gentle walk works. Even light movement around the house works. What matters is that the large muscle groups, particularly the legs, are engaged, because the legs contain the majority of your skeletal muscle mass. Engaging them after a meal is one of the most efficient things you can do for blood sugar in the shortest amount of time. But movement is only one part of this. There is something happening underneath the movement that I want to explain, because understanding it gives you a second set of tools that work right alongside physical activity. And this is where the picture gets deeper and frankly more interesting. Keep watching, because this is where many adults get genuinely caught off guard. There is a system in your body that controls blood sugar in ways that most people never think about. And it is not your diet. It is your nervous system. Your autonomic nervous system, which is the part that runs automatically without you thinking about it, governs a massive range of functions. Your heart rate, your digestion, your immune response, and yes, your blood sugar. And it does this through two opposing branches. One is the sympathetic system, which you may have heard called fight or flight. The other is the parasympathetic system, which governs rest, recovery, and digestion. Here is what the sympathetic system does when it activates. It raises your heart rate, it tightens your blood vessels, it increases muscle tension, and it raises blood glucose. Because when your body perceives a threat or a stressor, it floods the bloodstream with glucose to give you the energy to respond. This is a survival mechanism. It is brilliantly designed, but it was designed for short bursts of real physical danger. Not for the kind of chronic, low-level stress that most adults over 50 are living with every day. Chronic stress, the kind that comes from financial pressure, family worry, health anxiety, poor sleep, and simply moving too fast for too long, keeps the sympathetic system in a state of low-grade activation. And one of the direct consequences of that is chronically elevated blood glucose. Your body is continuously releasing glucose because it thinks it needs to be ready. But you are not running from anything. You are just living your life, and the glucose accumulates. This is where things often begin to go wrong for people who are doing everything else right. They are watching what they eat. They are taking their medication. but their blood sugar will not cooperate. And what they do not know is that their stress response is quietly and continuously undermining every other effort they are making. So what is the practical solution? How do you dial down the sympathetic response quickly? The answer is your breath. And I want to explain this properly, because most people have heard breathe deeply and dismissed it as too simple to be real medicine. It is not simple. There is a profound physiological reason why controlled breathing works, and it goes directly to the source of what is driving blood sugar up. When you breathe in, your heart rate increases slightly. You activate a mild sympathetic response. When you breathe out, the opposite happens. The parasympathetic system activates. Heart rate slows. Blood vessels relax. The stress response begins to quiet down. This is not metaphorical. It is a direct neurological mechanism, and it means that by deliberately extending your exhale, you are physically stimulating the branch of your nervous system that lowers blood pressure, quiets the stress response, and over time, helps normalize blood glucose. Most adults breathe at a rate of 15 to 18 breaths per minute. At that rate, the exhale is only about 1 second long, 1 second of parasympathetic activation at a time. That is not enough to counterbalance the continuous low-grade stress that many people are carrying. But when you consciously slow your breathing down to around 6 breaths per minute, breathing in for 4 to 5 seconds and out for 5 to 6 seconds, you extend your parasympathetic activation 5-fold or more. You are not just relaxing in a general sense. You are physically intervening in the nervous system loop that drives elevated blood glucose. And here is the part that most people do not expect. This works quickly. For many people, consistent slow breathing for just 2 to 5 minutes produces a measurable drop in blood sugar, a reduction in heart rate, and a shift in how they feel within minutes, not weeks. Now, I want to address something important before we go further. I am not suggesting that breathing replaces medication or that it cures diabetes. What I am telling you is that it is a real, evidence-supported tool that directly addresses one of the most overlooked drivers of high blood sugar in adults over 50. And when you combine it with the movement strategy we talked about and the dietary adjustments I am about to cover, you are addressing the problem from multiple directions at once. That is how you get real results. Let me now give you the dietary side of this, because it matters more than most people realize, and not in the way you might expect. The single most impactful dietary change for lowering blood sugar quickly is not eliminating all carbohydrates. It is changing the order in which you eat. Research out of Cornell University and several other institutions has found that eating protein and vegetables before carbohydrates at a meal, rather than starting with bread or rice or potatoes, reduces the post-meal blood sugar spike by as much as 30 to 40%. The same food, the same calories, just a different sequence. Why does this work? Because protein and fiber slow the digestion and absorption of everything that comes after. They coat the digestive system in a way that moderates how quickly glucose enters the bloodstream. If you start your meal with a piece of chicken or fish and some vegetables before you touch the starchy part of the plate, you have already changed how your body is going to process that entire meal. The second dietary strategy is one that has been gaining a lot of attention in research over the last decade. It is the use of apple cider vinegar before a meal. 1 to 2 tablespoons in a glass of water about 10 to 15 minutes before eating has been shown in multiple controlled studies to reduce post-meal blood glucose by a meaningful amount. The acetic acid in vinegar appears to slow the enzymatic breakdown of carbohydrates and improve insulin sensitivity at the cellular level. It is not a cure, but it is a legitimate, low-cost, widely available tool that genuinely works for many people. Third, and this one surprises people, cold water, specifically drinking a glass of cold water before and during a meal, has a modest but real effect on blood sugar. Hydration supports kidney function, and the kidneys play an active role in filtering excess glucose out of the blood through urine. When you are dehydrated, that filtering process slows down and blood sugar stays higher longer. Staying well hydrated is not a dramatic intervention, but it is something every person over 50 can do every single day with no cost and no risk. There is one more strategy I want to cover, and it is one that almost nobody talks about. But in 30 years of practice, I have seen it make a significant difference for patients who could not figure out why their blood sugar was behaving the way it was. And that is sleep. One night of poor sleep, defined as less than 6 hours or highly disrupted sleep, produces measurable insulin resistance the following day. The cells become less responsive. The stress hormones that stayed elevated overnight because of poor sleep continue to drive blood sugar up into the morning. And this effect compounds. 2 or 3 consecutive nights of poor sleep can produce blood sugar dysregulation that looks almost like early type 2 diabetes, even in people who do not have it. For adults over 50, sleep architecture changes. Deep sleep decreases. The sleep is lighter, more fragmented. This is one of the reasons blood sugar becomes harder to manage with age, and it is something most doctors do not discuss in a routine appointment. But it is something you can address. And addressing it meaningfully improves blood sugar control across the entire day. I want to take a moment here because we are past the halfway point, and I think it is worth stepping back and acknowledging something. Managing blood sugar after 50 is genuinely hard. Not because the tools do not exist, but because nobody sits down and explains the full picture. You get told to lose weight, eat less sugar, and exercise more. And then you try, and the results are inconsistent. And then you wonder what you are doing wrong. And then you start to feel like your body is just working against you. I want to be honest with you. Your body is not working against you. It is responding to signals. And when you change the signals, the body responds differently. That is the core of everything I have shared today. Movement changes the signal to the muscles. Slow breathing changes the signal to the nervous system. Food sequencing changes the signal to the digestive system. Sleep changes the hormonal environment that governs all of it. These are not separate interventions. They are all part of one interconnected system. And when you address them together, the effect is far greater than the sum of the parts. Now let me talk about something that matters enormously for people over 50 specifically: muscle mass. After the age of 50, the body loses skeletal muscle at an accelerating rate if nothing is done to preserve it. This process is called sarcopenia, and it has a direct, significant impact on blood sugar management. Because as we established earlier, skeletal muscle is the primary consumer of glucose in the body. Less muscle means less capacity to absorb glucose. Less capacity means higher blood sugar after every single meal, every single day, regardless of what you eat. This is why the most important long-term intervention for blood sugar after 50 is not cardio. It is resistance training. Lifting weights, using resistance bands, doing bodyweight exercises like squats and push-ups. Any form of training that challenges the muscles to work against resistance. Because resistance training is the primary stimulus that tells the body to preserve and build muscle tissue. And as that muscle is preserved and built, your body's capacity to manage blood sugar improves over time, almost automatically. I am not telling you to become a competitive weightlifter. I am telling you that 2 to 3 sessions per week of resistance exercise, even moderate, even at home with resistance bands, produces a cumulative improvement in insulin sensitivity that diet changes alone cannot replicate. And after 50, it is arguably the most important single habit change you can make for long-term metabolic health. Now, there is a concept I want to introduce that ties everything together. It is called neuroplasticity, and most people associate it with brain health or memory. But it applies here too. Your nervous system is not fixed. It is constantly adapting to the signals you give it. When you consistently practice slow breathing, when you consistently move your body after meals, when you consistently get adequate sleep, your nervous system begins to rewire itself around those patterns. The parasympathetic system gets stronger. The stress response becomes less reactive. The blood sugar regulation system becomes more stable, not as a sudden event, but as a gradual cumulative change that becomes more resilient over time. This is why consistency matters more than intensity. A 5-minute slow breathing session every day for 60 days produces changes in your autonomic nervous system that a single hour of relaxation cannot. A 10-minute walk after dinner every evening for 3 months produces metabolic adaptations that are measurably different from a 3-hour hike once a month. The body responds to repeated, consistent signals. That is how it is built, and that is where the real lasting change happens. Let me also address something that I hear from patients regularly. They say they tried these things, and they did not see immediate results, so they stopped. And I understand that frustration. When you have been living with elevated blood sugar, you want to see change fast. You want confirmation that what you are doing is working. Here is the honest answer. Some of these strategies do work quickly. Post-meal walking produces a measurable effect the same day. Slow breathing can reduce blood sugar within a session. Food sequencing changes the post-meal curve immediately. These are real, fast tools. But the deeper changes, the improvements in insulin sensitivity, the rebuilding of muscle mass, the rewiring of the nervous system toward a less reactive stress response, those take weeks and months, and they require you to show up consistently even when the early results feel modest. I have watched patients in their late 50s and 60s make these changes and genuinely transform their metabolic health. Not in a dramatic overnight way, but in a real, sustained, measurable way that showed up in their labs, in their energy levels, in how they felt getting out of bed in the morning. It happens. I have seen it repeatedly, and the people who got there were not the ones who found the most extreme approach. They were the ones who found what was sustainable and did it consistently. So let me bring everything together one final time. The absolute best way to lower blood sugar fast after 50 is not one thing. It is a combination of things that work together because they address the same system from different angles. Walk for 10 to 15 minutes after your meals, especially after dinner. Practice slow, deliberate breathing for 5 minutes a day. Breathing in for 4 to 5 seconds and out for 5 to 6 seconds. Eat your protein and vegetables before your carbohydrates at every meal. Consider 1 to 2 tablespoons of apple cider vinegar and water before eating. Stay well hydrated throughout the day. Prioritize your sleep, because one bad night undoes more progress than most people realize. And commit to some form of resistance training at least twice a week, because preserving your muscle mass is the most powerful long-term protection you have against blood sugar problems after 50. None of these things are extreme. None of them require you to overhaul your entire life at once. But each one is genuinely effective, grounded in real physiology, and within reach for any adult who is serious about taking control of their health. I want to say one more thing before I close. If you have been struggling with blood sugar for a while, and you have been frustrated, and you have felt like nothing you do quite works, I want you to know that your frustration is valid. Managing blood sugar after 50 is harder than most people are told it will be. The body has changed. The rules are a little different. And the advice that worked for someone younger or without these same challenges may not have been the right advice for you. What I hope this video gave you is a clearer picture of why your blood sugar does what it does, and real, specific tools you can start using today. Not someday. Today. If this video helped you, I would genuinely love to know. Leave a comment below and tell me which strategy you are going to try first. I read every comment, and your response helps me understand what matters most to you, so I can keep making videos that are actually useful. And if you want to keep getting honest, clear, practical health information built around how the body actually works after 50, please subscribe to this channel. Every video I make is designed with one goal: to give you the kind of information that helps you make real decisions about your health, grounded in medicine and delivered in plain English. Thank you for watching. Take care of yourself. I will see you in the next video.